Hello everyone, my name is Madison Norton, and today for my informative presentation, I'm going to demonstrate and explain how to measure a patient's radial pulse. This is one of the most basic but important clinical skills that a nurse uses every day. Measuring a radial pulse allows healthcare providers to assess a patient's heart rate and rhythm without using any electronic equipment, and it is a quick, non-invasive procedure that takes about 1 minute and can provide valuable information about a patient's cardiovascular health. Today, I'll just walk through the process step by step and explain why each step is important. So the first thing you want to do is introduce yourself to the patient. Before beginning any procedure, you should clearly state your name and your role. This just helps establish trust and allows the patient to feel more comfortable. Even though taking the pulse is a simple procedure, communication is an essential part of patient care. Next, you're going to want to prepare your patient by explaining what you are about to do. You can simply tell them that you will be measuring their heart rate by feeling their pulse at the wrist. It's also important to make sure that the patient has been resting for at least 1 full minute before taking their measurement. If they've just been walking, exercising, moving around, or doing any kind of movement, their heart rate may be temporarily elevated, which could result in an inaccurate resting pulse. Before touching the patient, perform proper hand hygiene. This can include sanitizing or washing your hands, which helps prevent the spread of germs and protects both you and the patient. Hand hygiene should always be performed before and after patient contact as part of standard infection prevention practices. Once your hands are clean, you can locate the radial artery. Ask the patient to relax their arm with the palm facing upward. Use your index and middle fingers, place them on the thumb side of the wrist, just below the base of the thumb. This is where the radial artery is located. It is important to not use your thumb because your thumb has its own pulse, which can interfere with obtaining an accurate reading. So it would look kind of something like this, but the patient's arm would be this way. It's just a little hard to show on this video. I'll insert a picture right here of the proper placement. After locating the artery, apply gently and firmly pressure until you feel a steady pulse. Finding the right amount of pressure is important. If you press too lightly, you may not feel the pulse clearly. However, if you press too hard, you can compress the artery and make the pulse disappear altogether. Once you feel a consistent pulse, you're ready to begin counting. Using a watch or wall clock with a second hand, count each pulse beat for a full 60 seconds. Although there are situations where healthcare providers may count for 15 to 30 seconds and multiply the result, counting for the entire minute provides the most accurate measurement, especially if the rhythm is irregular. While you're counting, don't just focus on the number of beats. Also pay attention to the rhythm of the pulse. Ask yourself whether the beats occur at regular intervals or whether they're often skipped, uneven, or unusually fast or slow beats. These observations may provide important information about the patient's cardiovascular condition and should be documented if present. After you finish counting, record the results in the patient's medical chart. Documentation should include the pulse rate in beats per minute and any abnormalities you observed during their assessment. This can include an irregular rhythm. Accurate documentation allows other members of healthcare teams to monitor changes in the patient's condition over time, just in case anything goes wrong. Overall, measuring the patient's radial pulse is simple and essential in any nursing skill. The process includes introducing yourself, preparing the patient, performing your hand hygiene, locating the radial artery, applying the correct amount of pressure, and counting the pulse for the full 60 seconds, evaluating the rhythm, and documenting your findings. A normal resting heart rate for most healthy adults ranges from 60 to 100 beats per minute. If you are unable to obtain accurate readings or notice significant irregularities, the pulse should be reassessed and additional evaluation may be needed depending on the patient's condition. Although the procedure only takes about a minute to complete, it provides valuable information that can help identify potential health concerns and guide patient care. Thank you all for listening. I hope you have learned how to accurately take a radial pulse. Thank you so much.